Hey everyone, taking a look at some models of the heart. We've got a normal heart in the middle and then two hearts with some sort of cardiovascular condition. So what's the difference? If you have a myocardial infarction, you probably know this better as a heart attack. If you're having a heart attack, what that usually is caused by is if you have a buildup of a clot or a plaque in a blood vessel, in blood vessels that are serving and feeding the myocardium of the heart. So like this coronary artery, for instance. If that coronary artery is blocked, then you're blocking delivery of oxygen nutrients to the myocardium, and that tissue will start dying. So this discolored area is representing a dead tissue. And if you have dead tissue in your heart, that means your heart can't function properly, and hence a heart attack. We can see here representing inside of this model, we've got a clot and buildup of damage here in this ventricle. So that is representing a myocardial infarction. Normal heart, of course, doesn't have that inside of it, but we see the normal shape of the ventricles here. Left ventricle is much thicker, right ventricle is thinner. Congestive heart failure, what does that mean? Congestive heart failure can be caused by a number of things. It could be diet, could be hereditary, but what's happening is the heart is becoming weaker and weaker. It gets enlarged and stretched out, and it's unable to pump as efficiently as a normal heart. So this, compare this to the relative size. In congestive heart failure, the heart becomes enlarged. This is, for most people who are not super endurance athletes, an enlarged heart is a bad thing. And see how much larger it is compared to a normal heart. The walls have increased in size because it's trying to compensate for some kind of other cardiovascular problem, possibly in other blood vessels or the heart itself. There's not as much rebound when the ventricles contract. You're not getting so much force. That's a problem. So that's what congestive heart failure is in a nutshell. Not a good thing if you have an enlarged heart. Normal hearts, normal-sized hearts have a standard amount of muscle tissue. You don't want to overwork your hearts. By overworking your heart, they'll get tired. Your heart's supposed to work 24/7 nonstop. You don't want to overwork your heart like it's overworked here in congestive heart failure. You definitely don't want to cut off oxygen and nutrients to your heart because that'll cause death. All right, those are just two of several things that could happen to your heart. Hope it doesn't happen to you. Try to maintain a healthy diet and exercise. All right, take care. Thanks for listening.